My name is Adam Herth. I'm a physician assistant here at Louisville Hip Knee Institute. Spend most of my time in surgery, helping out Dr. Green, also help out Dr. Gerasimides as well. Big question after joint replacement is wound care. So here at Louisville Hip and Knee, we do primary or first-time joint replacement, but also complex revision joint replacement. So most patients are having their joint replacement done for the first time. In those patients, as long as they have good, nice, healthy tissue, not too many risk factors, we close the incision with purely absorbable suture, meaning that all the sutures are underneath the skin, and then we glue on top of the skin. So it's nice that you don't have to worry about having stitches or staples taken out. Most patients get a dressing called an Aquacel, which looks like a big rectangular orange-yellow kind of Band-Aid. That is waterproof, so it's nice for patients because they can shower the same day of surgery or the day after. It's impregnated with silver, so it has some antibacterial properties as well. So that usually stays on for 7 days. Then after the 7 days, you can take that bandage off, and then we usually do an island dressing, which is something you can find at a Walgreens or CVS or any drugstore. And in your joint booklet, it talks about island dressings as well. So that is not waterproof. You usually have that on for a couple weeks just as the incision continues to heal. So we use those for both hip and knee replacements. Now, if a patient maybe is at higher risk of an infection, if their body habitus maybe requires a different type of dressing, or if we're concerned about any signs of infection, then we might use an incisional wound device, an incisional wound vac. So that is a negative pressure wound therapy device, which is just a fancy term for a vacuum seal. It keeps the incision completely covered, and it kind of increases blood flow to the area via that vacuum effect. So there's two different ones that we use primarily. So you might see a purple sponge on top of your incision. That's called a Prevena. That is usually a 14-day device. So the 14-day Prevena stays on for 2 weeks. You can shower with it on. It is a purple sponge with a tube that goes to a handheld controller. And you usually just set the controller kind of outside the tub on the rim of the tub, and then you can shower with it, which is great. The other one we use is called a Pico. That is typically a 7 or a 14-day device. So when you look at the white cube on your Pico, it'll say Pico 7 or Pico 14. Similar concept, it's a vacuum device. You can shower with it on. If you have the 14-day device, you leave it on for 2 weeks. If it's the 7-day device, you leave it on for 7 days, and then after 7 days, you cut the cord between the dressing and the controller, and then you leave it on for another 7 days and can still shower. So if you have a Pico or a Prevena, which we call in the office a wound vac, typically you'll have a follow-up in the office, which is 2 weeks out from surgery. At 2 weeks, you'll come in, you can take it off, and then we'll look at your wound. So if you have staples or sutures because maybe your skin couldn't tolerate different types of stitches, or if we needed a more secure closure, we'll usually take those off out in the office, maybe at 3 weeks, maybe at 2 weeks, just depends on whatever's safe for the patient. But that's kind of our typical flow of how we care for wounds, how we close the wounds. If you ever have any questions about the wound vac, you can always call. Usually you get an instructional pamphlet for the company on how to care for it. And then if you're comfortable, we usually will let you take those off at home as well if you need to. So a bunch of different ways to manage the wounds, but the #1 goal is to keep it clean, dry, prevent any infection. Usually don't want you soaking it in a bathtub, hot tub, ocean, swimming pool for at least 6 weeks. Some patients heal a little quicker than others, but usually 6 weeks is a pretty good rule of thumb just to keep it clean and dry. Certainly at any time, if you have any openings in your incision, drainage, redness, this feels like the incision is separating, you need to call us right away. You can always get in touch with one of our athletic trainers or medical assistants as well, or the PAs or doctors, whoever's in the office, and send us a picture and we can review it personally and let you know what to do.